um, nerve mobilization part 2.
Yeah, so welcome back, guys. Just a quick review from last time. We were talking about mobilization of the neural tissues. Last time we were showing you guys two drills for the upper body, also for the nerves that leave the cervical spine and go into the arm. So they are innervating the muscles and they're innervating the other tissue in the arm. And in general, what we see when we do neural tissue mobilization is that we oftentimes get great strength results, that we gain way better flexibility. And I think the easiest thing and something that you should always do is when you do one of these drills to figure out whether you need it or not, is test something that you think you're weak at, where you have maybe pain in a region where you think there's a restriction, mobility or motor control. Test that stuff, do the nerve glide and retest it. And what you will very often see is that you get great gains in any of the aforementioned topics that I've been talking about. So today it's the lower body. And when we want to mobilize the lower body, we are going to have to move the spine around quite a bit. That's why I think spinal mobility is something really crucial in CrossFit. We want to move, or in functional fitness, we want to move high loads. We want to do it quickly. It's very important that you learn how to stabilize the trunk. But I think one of the interesting things I've realized over the last decade is a bunch of people that have been fairly great athletes, they were afraid of putting the spine in any other position than neutral. That said, you should be able to move your spine in all directions. It should be flex and bend and rotate and side bend and go into extension. And you should be practicing that. And one of the reasons for practicing this is that your neural tissue always gets a little bit of mobilization as you're basically just extending and moving your trunk around. So trunk movement is super important, and we need to have really good trunk control or spinal control when we want to do the nerve glides for the lower body. So today I picked two nerve glides. One is or let me introduce it this way. I'm going to show you a slide of the human being one big nerve, and I'm going to share my screen with you guys now. So once again, a great app, it's Complete Anatomy. And what you're seeing here is, in essence, a skeleton. You'll have the spinal cord over here, and the fat part that's coming out here under your pelvis is the sciatic nerve. So it's one of the biggest nerves or parts of a nerve that that goes at the back of your leg, and it goes down to your very lower body, to your shin, and it's going to innervate a lot of muscles around the shin and around the shin bone and the fibula. And it's also, let me scroll down a little, and it's also, or I should say it, it's also innervating a lot of the muscles and tissue around the foot as well. So I'm going to show you one specific nerve glide for one of the branches of this nerve, the sciatic nerve. But what you can already see, if I move this around, if you want to get a bit of stretch on the nerve, one of the positions that we need to move into is hip flexion. So a hip flex position, when you lean over, when the pelvis tilts forward, you'll see that this nerve gets a little stretchy sensation. Another review from last time, I've been talking about tensioning the nerve. And if you start flexing your spine, so rounding your spine out, rounding of the spine increases the length of the spine up to like 8 to 9 centimeters in most people, which is quite massive. So we want to mobilize one of the parts of this nerve. So the nerve, I'm going to show you the next layer. So now you can see this nerve, it goes all the way down here, and then it branches out into a lot of different parts. And one part that we will be doing a mobilization for today is called the common peroneal nerve. So it's the nerve that's innervating the muscles at the side of the foot and at the lateral or the outside of your lower leg. So on the fibular side, on the peroneal side, and we want to mobilize that. It's it's a cool little drill. One way to use it, or one thing that you can assess with that is if you have an issue in dorsiflexion of the foot, this might help. So if you have a problem in your squat that your knee is, oops, that's a little bit unstable, that your knee is coming forward, the nerve is innervating the tip anterior, the anterior tip muscle, which kind of pulls the tibia forward and closes the angle between the foot and the tibia. This is one nice thing that you can use it. Just yesterday, I used it with somebody that had a very weird clicking in his knee joint because a tendon was jumping over there. So whatever, it's a great nerve glide that you could use to mobilize the side of the lateral, the outside of the lower leg. And I'm going to show you first of all the tensioning sequence, because that's the harder stuff to do. So how to put a little bit more stretch on the nerve. Then I'm going to show you how to slack the nerve, kind of opposing all the movements. And then I want you to remind you again of, if you're in pain, what you always want to do is, first, you want to slack the nerve, put the tension out of the nerve. So if you had a herniated disc and you're in pain, don't go into the tensioning sequence. What you should be doing is slacking the nerve. After slacking, you can do the sliding stuff where you put tension on one side and then tension on the other side, but do this very, very gently. And if you really want to tension something, go to the other side of the body for the same nerve that helps the most. And if you're getting out of pain, then slowly start building that movement again in the neural tissue in that nerve. So let's do the common peroneal nerve. I'm going to move back a little so that you guys can see me. One of the things that I want to mention again and say again is, let me stop the screen sharing. You can do these drills standing, you can do the drills seated. There's like a bunch of different ways. If you understand where the nerve goes, it's very easy to come up with a lot of different positions how to mobilize the nerve. I'm going to show you, in my point of view, that the easiest mobilization. If you're standing, very often people have balance issues and it's very hard for them to do it properly. So what we're going to do is, first of all, I'm going to put my foot into plantar flexion. So I'm going to put my foot into this position, and then as the nerve is going here on the outside, I want to put my foot into this really pronated position. So you can see the toes are pointing in. I think about elongating the outer side of my lower leg in here. So that's the position from the lower leg. So I'm in this position. And then, as I told you, the sciatic nerve leaves just below the pelvis over here. And then it moves to the backside of the body. So when I want to put a little bit more stretch on that nerve, I need to have a little bit of hip flexion or a little bit of more hip flexion. But hip flexion is, if you go into deep hip flexion, you should already feel a mobilization of the nerve on the outside. So in this position, that's our starting position. Then putting more tension on the nerve, we do this by flexing our spine. So what I want you to do is, vertebra by vertebra, I want you to start with the cervical spine, flex the cervical spine, then start flexing the T-spine. Then I'm going to start flexing a little lower on the T-spine. And finally, I can also start flexing my low back. So I'm rolling in, I'm rounding out. I'm trying. One of the things that most people do with their pelvis, when they go down, they let their pelvis tilt back. So they go into a posterior pelvic tilt position. Think about the pelvis staying in that position and then rounding in. So I got a pretty decent amount of stretch already in here. Keep it 3 out of 10. That's a great way of mobilizing the nerve or putting more stretch in it. Don't make it too harsh and too hard. I know a lot of athletes, they think the more the better. With nerve mobilization, you always want to be on the safe side because too much tension on the nerve can damage the tissue as well, which is not what we want to see. So that's the tensioning sequence. One more time. We go into plantar flexion. We are going into pronation. I'm going to keep the foot, the knee slightly pointing inwards. I'm going to flex at the hip joint. I already get a little stretchy sensation down there in the nerve. And then I'm starting to flex cervical spine, T-spine,
and then slowly over the lumbar spine.
When should you stop rounding your back? Do you feel something? Do you feel tension and then you stop, or?
Exactly. So if the tension increases too much, I said like do 3 out of 10. So if you already have a good sensation in here, there's probably not much that you need to do anymore in flexing the back. What I recommend that you start playing around with is, your spine has 2 major convergence zones. So if I start flexing, the cord is pulled a little bit up here at the top, it's pulled together, and then it's pulled down on the bottom. So what you can do is, one way of playing around a little bit, if I already have a good stretch in this position, I maybe just go there and extend again to put stretch on the nerve. What I can also try to do is, I could keep the cervical spine fairly neutral and try just rounding my mid back or my lower back and playing around with that so that I get different parts of the spine going in flexion extension. And this may change the tensioning in the lower body. If you really have like not too much tension, you can like go into full flexion of the spine and go there. That's actually should be one of the goals, is that we can flex the full spine without creating too much of neural tension.
Okay. Should you feel something in your leg when you are rounding your back?
Probably you'll feel something on the outside of the lateral leg, lower leg. This is once again the cutaneous distribution of the nerve. So there's the innervation of the skin is done by this nerve, and this is what you're going to feel, like a little tingly sensation. Yeah. Okay. So this is the first thing. Then the next thing is, I'm going to show you the slacking position. So slacking position is the total opposite. So now we were in plantar flexion and pronation. Now we do the opposite thing. I go into eversion and dorsiflexion. I'm going to rotate the knee out. I'm going to flex. So I'm in this position now. And then I'm going to extend my spine. I can lean back and just hold the position. And for a lot of people, like slacking the nerve, if you had an injury to the spinal cord, and you do this, you'll have an amazing result. So if you're pain-free in this position, try to go into the slacking position of the nerve and just like stay there for a couple of minutes. What I really like to do is, I don't have a Swiss ball in here or a Petsy ball, but you can use a Petsy ball to support you a little bit. Then you can easily go in trunk extension without the need of holding muscular tension. So
in the floor, you will be lying in the floor.
Yeah, I can lie. I most often do it on a couch. So I'll move to the couch. I'll put the ball right behind me. I'll lean back, and then I'm going to just hang out here and try to position. And it feels, if you have an issue with that, it oftentimes feels really good.
Can you use the wall ball?
Yeah, I could try it, but I think it probably gives me a little bit of support. The good thing about the Petsy board, it's a little, but I
softer,
could use it. Yeah, it's a little bit softer, but I could use it as well. I think it's not that comfortable, but it's okay. Yeah, it works. Good idea. So this is slacking, so putting all the tension out of the nerve, and then we can play around with these sliding sequences. So sliding sequences, I put tension on the nerve on one side. So tension on the nerve in the lower foot means I'm going to extend my leg, my foot, and then I'm going to bring it inwards, and I'm going to rotate my foot a little inwards. So now, as I'm not flexing my hip, I'm not putting too much stretch on the nerve. So if I want to tension it now from the other side, I need to start flexing my cervical spine, my thoracic spine, and finally my lumbar spine. And as I see the build-up in tension over here, I'm going to slowly pull the foot out of the tensioning position. And then when I want to put tension in here again, I put the foot down and in. I'm starting to extend my spine again. So once again, on the one hand, if I increase the tension from the other side, I'm going to release the tension on the lower side. If I'm going to increase the tension from the lower side, I'm going to release the tension from the other side. And this actually creates a lot of nerve movement in the tissue, more so than just stretching the nerve. By pulling from both sides, the nerve learns to move really well through the tissue. And one more thing is, like, these drills are all static. If you're warming up and you're an athlete and you're pain-free, what I recommend is that you do the drills with we call it different drivers. So you stay in a position where you have like a 3 out of 10, and then I probably start doing something like this. So I have a little tension in here. I can go, okay, I'll make a little foot circle. Do you see that? Yeah, I'll make a little foot circle. So I use the foot as a driver. I could also go like bend my knee, extend my knee. Okay, I could go flexing tilting the pelvis one way, tilting the pelvis the other way, tilting the pelvis one way, tilting the pelvis the other way. I could only work with my neck. So extend, flex the neck. And like nerves entrap in different positions. So one thing that I like to do with this one, because one of the entrapment positions oftentimes is in the lower back or the piriformis muscle, is that I go into a standing position and I go down here, slight flexion, and then I mobilize my pelvic position. So I'm in this position, and then I start trying to move my pelvis in both ways. That's a great way of mobilizing the nerve. And
what do you recommend before training? Like, what will be the routine? Would you do a stretch, flossing, and slacking, or slacking first? And
you know what? Well, if you have an injury and you want to do light training, I would recommend that you slack it or mobilize the other side of the body.
Okay.
If you're a normal, healthy athlete with maybe a little bit of like if you sense that you build up a lot of neural tissue, neural stretch when you go into like mildly into these positions, I recommend that you mobilize these positions a lot. And what I just said is when you're more like an athlete, I would recommend that you don't just statically hang out in these positions, but that you actually move around a little. So I'll move my foot, I'll move my knee, I'll move my trunk as I do this, so that I get a little bit more mobilization in maybe in the positions that I also want to use in the workout as well.
Okay.
So if I have for example, I have a deadlift workout. There's a different nerve that I would mobilize when I do a deadlift workout, but just I'm using the same nerve right now here. I go into this position. Okay, what I want to be able to move really well. I want to be able to control my pelvis really well, so I'm mobilizing my pelvis in this position, and I'm creating this stretchy sensation. I can use my lower back a little bit more, so around the lower back, extend the lower back, around the lower back, extend the lower back. That's what I would do before the workout, if I warm up for the workout. Or like the sliding sequence is great for warming up. I'm in this position and I'm going to go down, release tension at the bottom. I come up, increase the tension at the bottom again. That's a great way of, if you're pain-free, that's the best thing that you can do to get really good sliding of the nerve and the tissue.
Mm-hmm. Okay, great. And if you have pain, would you recommend before training doing the slacking?
Yes. And you know what? That's a general recommendation. What I always would do is test it out. As I said before, if you have a lack of strength, lack of control, pain, do the drill and see if the drill improves it. If the drill is not improving it, don't do it. It's a waste of time.
Okay.
Does it make sense? So I have pain, I go slacking, okay. Depending on what kind of pain it is, it might be way better. Great, use the drill before you do the workout. If you have pain, you do the drill and nothing changes, you're probably working on the wrong nerve. You have a different issue. You have maybe a more local tissue issue or something else that's wrong with your body that's producing pain. But test it, retest it, and see if it gets better. I think that's the most important recommendation that I can give. Okay. Okay, so I want to show one more nerve block. So this is for parts of the sciatic nerve, the fat nerve that goes down. I'll show it here again. That's which
probably a lot of people have issues with that nerve due to, you can see when some people are doing a squats or deadlift that either their glutes are not activated, their hamstring is not, the rounding the back for some of these. So that leads into pain, back pain.
Yeah, I think it's cool that you mentioned it again, because one of the very interesting things with this is they made some really cool tests with people, and just by mobilizing the parts of the sciatic nerve with a couple of these nerve glides that I've shown, or with one of the nerve glides that I've shown, is you can increase the range of motion quite dramatically. When you think like, oh, my hamstrings are really tight, you do a little bit of nerve mobilization, the nerve tissue is able to move better through the body, and suddenly you have way more range of motion in that part of the body as well. So your hamstrings, the firing is better, the motor control is better, and suddenly your range of motion improves quite a bit. But I agree, and what you also see if you look at the literature about back pain, you see like this kind of like steep increase in damages to the spinal cord, or let's say spinal structures, as people get older. So if you look at the population of 85-year-olds, what you will see in a lot of them is that they have herniated discs, they have spondylitis, they have so many issues with their spine basically. But what you still realize is that they don't have any injuries, like they have no pain. And then even with healthy looking spines, what we oftentimes see is that they have pain when they're moving or even when they're in static positions. So the tissue damage itself is oftentimes not a reliable predictor of pain or not. And one of the things that might be helping, and that's why movement and back movement is important, and also like mobilizing these nerve tissues, very often if the nerves can't move, the output of the body is like a pain signal, and we can modulate that pain signal by or decreasing that pain signal by giving more movement capacity to the tissue itself. So I think it's very worthwhile playing around with these drills. They are excellent drills. So this is the sciatic nerve. It's like at the back side of the body. I want to show you one other thing that's something very common as well. Let me get off one layer. So you see that's the sciatic nerve at the back. If I go up a little, here you see the femoral nerve. So I'll turn this around a little or zoom in a little. That's actually better. There you go. That's not good. So this is the femoral nerve. It leaves here, I think it's around at the level of the L4, L5, and the femoral nerve actually is innervating the it leaves at L2, L3, and L4, and it's innervating the quadriceps muscle, and also parts of your inner thigh, so your parts of your adductor muscles. And if I go to the next layer of nervous tissue, what you'll see is it's a little bit hard to see, but it branches. It's almost impossible, but it goes all the way down, and it also goes to the inner part of the lower leg. So the peroneal nerve was covering this part of the leg. The femoral nerve is going to cover the inner part of the lower leg. Yeah, so that's the cutaneous distribution of that nerve, and it innervates the muscle tissue. So what we oftentimes see when people have issues with that nerve is that they have, like say, bad hip mobility. They have pain in their hips. They have knee pain. They have a very weak hip flexor or weak quadriceps muscle. So how can you test the hip flexors? You could go like, hey, I have issues bringing my legs up and holding my leg up there, like in an L-sit position, like in a toe to bar position. That would be a really good test. You could lie on your back like this, put your knee in, have a partner pushing your knee away, and you trying to keep the knee in that position. And this muscle should be really strong. Like your partner should not be able to push your knee away if the muscle is working properly. So if you have any kind of hip pain at the front when you're squatting, or you have weakness in the muscle, that's a great drill for you. So as you can see, the muscle runs at the front of the thigh. So if I want to put stress on the muscle, what I need to be careful with is that I stay in extension. So for all the other drills where the nerve was at the back of the body, I had to flex my hip. Now I want to keep the hip in extension. So I'm going to show you guys, I'm going to show you guys now the positions that we want to go to when we put stretch on the nerve. So the first position is as the nerve is running a little bit at the front or a little inner side, front side of the knee, what I need to make sure of is that I flex my leg. So have an easy flexion of the leg. Don't make this too tough or too hard. Otherwise, you'll feel a quad, more like a quad stretch. That's not what we are looking for. The next thing is I need to go into a posterior pelvic tilt and pull my pelvis up this way. Once again, you might feel a little bit of a muscular sensation here. The goal is not to stretch the muscle. The goal is not a hip flexor stretch. You might feel a little stretch in the hip flexor, but if you feel a lot of stretch in the hip flexor, move back a little bit and pull tension out of the hip flexor. Okay, that's a really good recommendation. It's not about flexing it's not about stretching the hip flexor muscle. From this position now, what we're going to do is you can play around a little bit with what you're doing, but now we need to use the spine again to create a little bit of that stretch. So the nerve, it's at the front side of the body, but it goes back to the spine and enters the spine. So at level L2 to L3, L4, so in the lumbar spine. So what I can do is the first thing that I could try out is I'm going to flex my cervical spine and I'm going to flex my T-spine without pushing the butt back. If I start flexing my hip, I lose tension immediately. And I already get a good sensation of stretch in the nerval tissue if I just do this. I feel like a tingling sensation in the front of my thigh. Okay, if you feel nothing, what you can play around with is lateral bending and rotating. So the nerve, it enters the spine from the right side. If I do a left tilt or a little rotation, and then I start flexing, I might feel a way better mobilization of the nerval tissue. So pretty easy. I'm in this position. I have a relaxed knee bend. I put my hip into extension. I'm either just flexing my spine, or I can rotate away from the leg, from the behind leg, and then start flexing. I can play a little bit around with side bending and spinal flexion. And then once again, I'm trying to figure out where I feel no stretch, where I feel the most stretch. So this is, once again, it's a tensioning sequence. This is how you put tension in the nerve. And what you most often feel is your upper thigh. You feel like a little tingling sensation. You don't feel so much the cutaneous distribution in the lower leg. I don't know anybody that's actually really feeling that. Okay, so how can we put slack in the position? So how can we make the nerve being in a position where we pull out stretch, so where we leave stretch out of the table? And what I recommend doing is that I'll show the right leg again, so that you raise your leg, that you hold on to something. When we were in this position for the right leg, I can see I need to flex my hip to actually get into a position where the nerve relaxes. I can put the foot up a little bit onto something to relax. And then what I also want to do is, I was leaning to the left and flexing. So what I'm doing now is I'm leaning to the right and going into extension again. So this is the position where the nerve almost has no stretch in it. I'm in an extended position with my spine, and my leg, my hip is in flexion, and the lower leg is totally relaxed. I just hold this position, try to relax in that position. Once again, that's what you're doing when you have back pain, or when you had a herniated disc and you feel that the nerve is not really activating on that side. Slacking.
For how long should you hold that position?
Start with 30 seconds, go up to a minute, but you should feel like the hard thing about all these things is it's oftentimes very dose dependent. It's like you have this kind of U-shaped curve where you initially see a pretty good response, then the good response reaches kind of like a plateau, and then then it starts going down again. Think about it like doing strength training. If you do way too much volume, you'll blunt your response. If you do way too little volume, you'll blunt your response. But I think a good starting range for almost all these drills is 30 seconds up to 1 minute. And if you feel that you get better with doing it longer, try it out and see if that's really the case.
Do you repeat it? So you do it from 30 to 1 minute.
Yeah.
How many rounds you have to do it?
If you want to create good neural plasticity, what they found out is that it's actually way better to not do 5 sets in a row of 30 seconds, but that you mobilize it, that you take a little bit of rest, and then you do this a couple of times throughout the day.
Okay.
That's where you actually see really good results. Like go do it like 5 to 6 times over the day. Maybe you do it 2 to 3 times in your training sessions, but then another 3 to 4 times after the training session as well. That gives you really quick and fast results, because you're constantly reteaching your body what to do with the nerval tissue, and that it's able to move in the surrounding tissues.
Mm-hmm.
So I think that the last thing that I want to show you guys is how you can modulate this is, once again, in a warm-up. For example, I could go like, okay, I go into a little position of stretch, and now I can modulate the tension of the nerve by doing pelvic tilts. I could go like, I really go into hip extension and start just nodding. This will, like, getting down will increase the tension, getting up will decrease the tension. I can play around with the rotation in this position. I could play around with bending the front leg a little bit more and going into more hip extension. So these are things that you can do if you want to be a little bit more movement orientated. You move your pelvis, you move your low back, you start rotating, getting into positions where there's more tension and less tension. Always remember, keep it 3 out of 10. Don't overdo it with the stretch on the tissue. Okay. So these are two nerve glides for the lower body. There's a bunch of other nerves or branches of the nerve that innervate the lower body musculature. We are going to make a mini series of these nerve glides so that you can actually use them on your own, and that you can quickly pick the ones that you need for the future. And we will be releasing one every week. It will be a very short video, but I think it's something that everybody should be knowing. It's one of my favorite quotes from Kelly Starrett, that you should be able to what is it like to have like being able to properly maintain your own body. It's kind of like, I paraphrased it now a little, but I think this is like a key asset that you have in your toolbox to having basic maintenance on your own body.
Yeah, I think a lot of people uses, at least here in Spain, it wasn't like that in Denmark, but a lot of people uses here physiotherapists whenever they have any pain. I'm kind of anti-physiotherapist, because every time that I go, they treat, the end of the pain, which they might solve it for a few days, but the root of the pain is still there. And they don't even, assess the root. They don't even tell you what you should do to avoid that. And I think a lot of people uses physios. I personally prefer chiropractic, which I think they work a little bit with nerve. They just crack you down, so the nerve gets released. I think these exercises will be more on the prevention. So then you are allowing the nerve to be loose, so you don't get to the point where it gets pinched and blocked, and then you need to go to the chiro or whatever you go.
It's cool that you say that. But I think what you said about like physios, it holds true for a lot of different people, is they never go to the root cause of the issue. They treat the symptom. It's like I think the nemesis of modern medicine oftentimes is treating the symptom and not the cause of the issue.
Yeah.
But that said, I think there's a bunch of people who really understand the topic and doing amazingly well in these fields. But for the nerve, I think it's a great tool of prevention, and also allowing you, if you do it pre-training, to have better control of your body. But the other thing, it's an amazing tool for rehab if you're in a current pain situation.
Mm-hmm.
I don't know if I told you, but I had a client with a herniated disc, and they were talking about doing surgery and blah 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 blah. And I played around a little bit with sliding on the other side, but then I made her do a slacking drill for, I think it was 45 seconds, and she really increased her range of motion from like pain-free. She was in pain over here, and she was a dancer, and she could go down all the way to the floor again after a minute of slacking, like putting stress out of the nerve. It's you can see really great results if you're hitting the right nail.
Right spot. Yeah, that's pretty good. I'm looking forward to see those set of videos, because I think that's way easier for people to follow some kind of routine, kind of the wrong word of nerve mobilization. That will be pretty good. And it's something, I guess, that you can add it to your stretching routine, right? You can do both at the same time.
I think that should almost precede stretching, because if you have, especially if you do kind of like passive stretching, I think it's still good to do the passive stretching whenever. But I think if you do something like contract, relax, antagonist, contract, like all these, let's say, fancy ways of stretching, where you go into stretch position, increase the tension on the antagonistic muscles, then you increase the tension on the other side of the muscles, especially if you have poor motor control of the muscles. I think it's very beneficial to do this stuff before you even start the stretching drills, because you have better control of the better neural control of the muscle, and you can get deeper into the positions later on. And very often just doing these drills will increase your flexibility. That's kind of like the really amazing part of it. If I do a drill where like I have been showing you guys, if I do something that's for a different nerve, it's different foot position, but if I do a mobilization of this nerve now, and I do this a couple of times, and then maybe I do something where I go from the pelvis, and then I go, okay, I retest my flexibility. It's almost like I get instantaneous mobility on the side where I was just flossing the nerve. It's like you will see really cool stuff playing around with these drills.
Okay.
Cool.
Was pretty good. I think that's it for today, right?
Yeah, I need to leave.
Yeah, no worries. Cool, Basti. Great podcast again, and looking forward to see the drills.
Yeah, I'll make I think I'll do like 20, around 20, and I'm going to send you all of them.
Okay, sounds good.
Cool. Adri,
Basti, speak to you soon.
about fitness. See ya, man.
Bye.